All this involves faith. I mean, you look back at your life and you see where the miracles were. Craig Thayer, I'm a physician at Hamilton Wound Care and Hyperbaric Services with Vitruvian Health. I was 16, was my junior year in high school. I took an anatomy physiology class, and the human body was so incredible I had to go into medicine. That same year I was tutoring some blind students in geometry, so I knew I liked to help people. My education started at UC Davis, 14 years, 4 years of undergrad biochemistry, 4 years of med school, 6 years of residency. Finished there, I was the last resident to hang my own shingle and begin a private practice and learning the business of medicine, and then was there for over 30 years. During that time, was early on brought into leadership with Surgical Review Committee for 8 years, and Chief of Staff and Post-Chief of Staff, and then Trauma Medical Director for 20 years, and created a Level 3 certified program. So the type of care I provide currently is wound care and hyperbaric. So, as a general surgeon that actually got trained to do like thoracic, vascular, oncology, and I'm robotically trained, I initially am like, okay, am I going to use all my skills? The answer is yes and no, because the reality is I've realized how important wound care is. If misdiagnosed, mistreated, they can be permanently injured, or they may lose an extremity. We see a full variety of people from ages 18 to 95, and a myriad of different medical problems. But the bottom line is, it's not just about the wound, it's about the patient, someone's life. When I first meet a patient, I introduce myself, sit down and talk to them, learn about the history, what they're there for. And I think in that conversation, the fact that I'm listening attentively and asking questions, I think they see someone who really cares, and that's important. It's not just the family that makes this place superior, it's also the care. One example is Cancer Center, and they have a cancer center that's got more resources than from Nashville to even probably below Atlanta, that they just don't have. State of the art, the protocols, etc. is just amazing. My favorite part of the job is being part of the team. So it's a team. It's always a team. I mean, there may be a quarterback, he calls the play, but if someone doesn't catch the ball, if someone doesn't block, you're kind of worthless, right? So, it's the team. And part of the team is the patient, right? So patient's at the center and the team's around the patient. Before I was more in it, directly involved with trauma and the immediate hands-on. But you still get that reward of knowing someone's wound is healed, they're discharged from the clinic, they're back to their life. Conversations you get to have with them about Christianity or life and family, and you get to know these people, there's just no words for that.